Hello, my name is Megon Rivera, and then this presentation is going to be on Eating Disorders Therapy Group. It's my group proposition, and then this has been created for the Social Work Department at King University for clinical advocacy in groups and families with Professor Denise Anderson. Okay, so the title of the group that I'm proposing is Eating Disorders Therapy Group. The reason I have selected this title is to just make it really clear to potential members what the group is going to be about and who the group is geared towards. So Eating Disorders Therapy Group will be a therapy group. This group will incorporate cognitive behavioral therapy techniques used to encourage positive behavioral changes for those that struggle with various eating disorders, including but not limited to binge eating, anorexia nervosa, and bulimia. Other modalities that will be used in this group include psychoeducation and rational emotive behavior therapy. Psychoeducation will be provided to help members better understand the effects of eating disorders. And then relational emotive behavior therapy will be used to help individuals move to a place of rational thinking through the use of various techniques. So next, I want to touch on the purpose of the group. Schomburg et al. Actually state that eating disorders are serious mental illnesses that affect millions of individuals worldwide, regardless of race, age, nationality, or sex, and incur considerable personal, familial, and societal costs. So for this reason, I do believe it is crucial for this population to have support as they work through these mental disorders, especially since one-on-one counseling may not be available to everyone in this population. So the goals of this group may include rewiring one's self-image, boosting self-esteem, learning coping skills to deal with their triggers, whether the triggers are caused by feelings of anxiety, anger, or sadness, as well as changing one's thoughts from irrational to rational, and maybe even working through some of that trauma that may be triggering their eating disorder. Next, I want to go over the format for this group. So this group will be a therapy group. Eating Disorders Therapy Group will use the following modalities as previously mentioned: cognitive behavioral therapy, psychoeducation, and relational emotive behavior therapy. These modalities have been found effective in treating those with eating disorders in a group setting, as one can actually see on this slide. So the first quote under modalities is Reese 2002 found that a time-limited 12-session group integrating cognitive behavioral therapy, CBT, psychoeducation was effective in treating bulimia nervosa. So this shows that CBT and psychoeducation have been used to treat eating disorders, and in the process were found effective, especially in bulimia nervosa. So the second quote takes the focus on using relational emotive behavior therapy in treating eating disorders, specifically binge eating. And this quote actually states that after completing the REBT-based binge eating behavior management program, the experimental group had a significantly higher self-esteem score than the control group, thereby providing evidence for the effectiveness of this program. So these modalities have been used in treating eating disorders as they help these individuals boost their self-esteem, learn coping skills to work through triggering feelings, and help individuals move forward towards rational thinking and rewire their self-image. So now the plan for the functioning of this group will include a focus on the number of group members allowed, how frequent the group will meet, the length of time the group will meet, whether this group will be closed versus open, and lastly, the time of the meeting. So this group will hold between 8 to 12 members, as it is crucial the group does not get too large, preventing cohesion. In the study conducted by Abdullah Power et al., they found that their group of 12 members was able to see progress in their eating disorder symptoms. So I have chosen to base the group size off of that study. And then a group any larger than this may actually struggle to form and build appropriate relationships. And a group too small may not be able to provide enough feedback to one another. And the whole goal is to really create that cohesion in the group. So this group will meet weekly for an hour and a half. This allows for consistency while preventing an overwhelming number and length of meetings. An hour and a half allows clients the time to get work accomplished while still allowing individuals to get back to their busy lives. And Corey had actually mentioned in the textbook that this tends to be the standard time for outpatient groups. The group will be an open group, so that means it'll meet indefinitely, as some members may only need 12 weeks as seen in Wanlas et al. Study, while others may need a year or more as seen in Abdallahpour et al.'s group. So this ensures members are able to kind of stay for as long as they need. Well, if others are ready to leave more quickly, then it is not going to affect the function of the group as much. And then the group will meet in the evenings around 6:30 p.m. on Wednesdays, as this allows time for workers to get home from work and eat dinner and get their families kind of in order before getting to group. Next, I would like to address the group conditions. So kind of what this group needs to look like space-wise and that kind of thing. So when creating a welcoming and suitable working environment, there are going to be many things to take into consideration. For this group, the space would need to be open and comfortable enough for 8 to 12 people. The chairs in the room would need to be in a circle facing each other. This is to create a warm environment where no one really feels inferior. So when looking at forming a group, financial support is also going to be something to consider. From personal experience, I have seen it beneficial to use group members' insurance to cover the cost. This may look different for each individual group member, and it may need to be adjusted accordingly. So if an individual's insurance will not cover the cost of services, or their insurance will only cover so many group sessions, then grant money may be used to help support this individual. So going in and filing for a grant will also be necessary for running this group. When it comes to transportation, this could also be a struggle for some individuals. And one thing that I have seen also to be beneficial in aiding individuals with transportation is by providing gas cards to those in need. So gas cards would be bought through the grant money, and they could be given to members that are struggling to make it because of transportation reasons, whether it's they lack the gas money or whether they lack the actual physical transportation, and they're able to give it to a neighbor or a friend to help them get to and from group. And then overall, another thing I guess I would like to establish is having coffee and water available at every meeting. This is just a common courtesy, and I believe that most groups have this readily available for members as they come in, especially after a long work day. The next thing to take into consideration is going to be recruitment strategies. So when looking into recruiting individuals to join this particular group, there's going to be much also to take into consideration for this too. And Corey actually reports on page 57 how a group is announced influences the way it will be received by potential members and the kind of people who will be attracted to it. So I believe this group could work in an outpatient mental health facility with referrals from both staff and from hospital clinicians. This would allow room to make the group known to those that are directly affected by eating disorders. This may look like having pamphlets available in the outpatient office and in the hospital, ready to reach those in need of this group. Recruitment may also look like adding the group information to the outpatient website. That way, if people are Googling or whatever, they're able to kind of find it. Now, after figuring out the recruitment process, it's going to be important for the group leader to decide inclusion and exclusion criteria for the members. So Corey actually states on page 58, group facilitators identify group members whose needs and goals are compatible with the goals of the group. So this means taking a look at who is going to benefit most from this group and who is it likely to harm. So exclusion criteria may include those who are not ready to work on their eating disorders or work towards recovery, right? Or those who don't work good in a group setting. Maybe the ones that are kind of excluded from the group and referred more to one-on-one individual counseling. Now, inclusion criteria would then just kind of be the opposite. It'd be those that are ready to work, those that are ready to kind of build those skills and work towards a recovery process for their mental health when it comes to eating disorders. And those that also work really well in groups and are ready to learn from one another. Now, there are always going to be problems with getting anything started. So in the case of starting a group, one must consider issues with recruitment, permissions, and even screening. So getting the word out may be the most difficult part of recruitment. When it comes to recruiting individuals for this particular group, it'll be crucial to build a relationship with the hospital to ensure referrals. Next, getting permissions could be a challenge from the board of the outpatient facility, especially if there's an issue with space or if there are concerns with funding, which is why it's going to be important to kind of have the finances in order and ready to go prior to the proposal. And then when it comes to screening, the problem could be that the individuals might lie about their readiness, or they might think that they're ready and then they later realize that they aren't as ready as they thought they were. So once this group has been established, it's going to be important that the leader engages the group to keep them involved. So Corey discusses the importance of creating a trusting environment at the first meeting by stating, without trust, group interaction will be superficial, little self-exploration will take place, constructive challenging of one another will not occur, and the group will operate under the handicap of hidden feelings. So this leads me to think of engaging ways to lead the first meeting of a group that will create trust. So how can I create this trusting environment to kind of prevent some of those negative things from happening? So to engage individuals in the first meeting, I will discuss confidentiality and go over what that looks like in a group setting. I will also review the purpose of the group and go over goals, as well as encourage the group to begin to think of personal goals. I think this would also be a good time to kind of go over group rules and create group rules, because as you create those group rules together, it kind of helps build that trust of what we expect out of one another. I also believe an icebreaker could be beneficial, as it allows group members to warm up to new people. And since this will be an open group, I do believe it will be beneficial to repeat this information as new members join. And then by reviewing all this information, it would also establish me as the group leader and the group facilitator for these individuals. Although one hopes for a smooth engagement, one also must be prepared for challenges in engaging. So when taking a look at this particular population that the group is going to serve, there are challenges to consider. One of those challenges are actually mentioned by Schoenberg et al., who states individuals with eating disorders may fail to report the psychological components of eating disorders or have some poor insight into their level of impairment. So this can make it difficult to engage these individuals if they're unwilling to be open or lack the knowledge of what's kind of going on with themselves to be open. So another challenge in engaging this population is also stated by Schoenberg et al., and they state that most individuals with eating disorders do not enter treatment. Those who do often do so many years into the course of the illness. So this is definitely going to be something to take into consideration, that many of these individuals that are joining the group are choosing to step out. And it might be their first time stepping out and actually receiving help. And so this could be a challenge that we might have to help them overcome. Okay, so another point of consideration is the issue of power and privilege from a leader versus group member perspective. Corey states on page 67 that, in summary, although many variables are related to creating norms and trust during the early phase of development, the optimum balance between too much and too little direction from the leader is one of the most important. So this is where I would work on creating balance in the group to prevent that feeling of a power imbalance going on. Now, I would do this by guiding the group with open-ended questions while sitting back and encouraging as much group discussion as possible and not feeling the need to jump in with solutions at every issue that arises. I would also come from the perspective that clients are experts on themselves, and I believe this would create more balance in the group. Now, another way to work through positions of power and privilege is by becoming a more culturally competent clinician. Corey states that if you are open to the values inherent in a diversity perspective, you will find ways to avoid getting trapped in provincialism. And you will be able to challenge the degree to which you may be culturally encapsulated. So this is going to be my key to responding to those that are different from me. I will not only choose to kind of learn privately about various cultures, but I will also be open to learning from my clients about their own cultures. As I said, they're experts on their own lives. They know themselves the best. Okay, so part of the planning process for any group is establishing what intervention modalities you expect to use. So, as previously mentioned, techniques from cognitive behavior therapy, psychoeducation, and relational emotive behavior therapy will be used when conducting this group. Abdullahpour et al. States the findings provide evidence that the integrative cognitive, emotional, and behavioral techniques of REBT are appropriate and useful for treating the binge eating disorder and bring about positive changes in the factors involved. So these techniques may look like encouraging self-examination, self-discovery, and self-acceptance, while also pulling things from CBT techniques like teaching coping skills, providing information on what eating disorders may look like and how they may affect an individual. Others might include challenging faulty thinking, providing feedback, and helping aid in cognitive reframing to the group. So, while using these techniques, it is also important that as the leader, I work toward having a cohesive group. This takes me back to the topic of forming trust in the group. And Corey actually states that as members reveal more of themselves, the group becomes cohesive. In turn, this emerging cohesion strengthens the trust that exists in the group and creates the right atmosphere for members to try new ways of being in the group. So this means that trust and openness create a cohesive environment. So I will create this by encouraging group confidentiality, helping establish rules that create safety, and by overall encouraging participation from all members and making sure that nobody feels left out in the group. The termination process for this group will look differently as it is an open group that has no definite ending. This means that the termination process will be individualized for each member as they leave the group. The group will be encouraged to explore how they feel about the changing dynamic of a member leaving. The leaving member will then also be encouraged to reflect on their time in the group and explore what goals they will continue to work on after they leave the group. This is going to allow room for all the members to really process the changes moving forward. Lastly, the focus will be on evaluating the effectiveness of the group. This can be done in a various number of ways. In Abdullahpour et al. Study, an assessment was given to group members to measure their level of esteem at both the beginning of the group and at the end. And this was to provide a numerical answer to the success rate of each individual that participated in the group. In Wanless et al. Study, they also conduct assessments to measure each individual's progress and thoughts on participating in a group. And they found that group members had a sense of belonging while being in the group and were able to work towards healthy habits. So similarly to these two studies, I will conduct pre-group assessments on every member and one as they leave. This will kind of show the statistical growth of each individual and overall the effectiveness of the group. So overall, there is a need for those that struggle with eating disorders. Group therapy is a great way to reach those that may not qualify for one-on-one therapy. It also gives individuals a sense of belonging and the ability to learn from one another. Here is my reference slide. I'll give you a second to look at those. And lastly, overall, I just want to thank you for taking the time to listen to my presentation on establishing a group for eating disorders. Thank you so much.